Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Heart sound S1. So this heart sound S1 occurs during the isovolumetric contraction. So it is also associated with the closure of the tricuspid and also the mitral valve. The closure of the tricuspid as well as the mitral valve. Next, the characteristic is there is a sound like a spoken word lub in the phrase of lubbed up. The sounds like a spoken word lub in the phrase lubbed up. So it occurs in the isovolumetric contraction and associated with the closure of the tricuspid and the mitral valve, MT valves. So the loudest of them will be the mitral area. So S1 is loudest in the mitral area and also the sternal end of the left fourth costal cartilage. So it is produced during the isometric contraction and the early stages of the ejection. So it is lengthy, it is low pitched, and it sounds that last for about 0.10 to 0.17 seconds.